dementia is, we describe it as a syndrome that involves degeneration of neurons in the brain and ends up causing such an individual to have lapses in memory. They have difficulty with participating or carrying out their activities of daily living. They start having difficulty with those simple tasks that we all take for granted. So when we see that, and we tend to see it in older people, so they're forgetting people's names, places that they were familiar with become unfamiliar. They have difficulty with simple things like dressing up. Even when they go to take a shower, they don't do it appropriately. They might lose the capacity to now realize that it's inappropriate to pee, in the bedroom rather than go. So that confusion and disorientation can make them start doing things like that. They're not able to retain new information. So you ask somebody, what did you have for breakfast this morning? And they're not able to recall it. They might be able to tell you what happened 10 years ago, 20 years ago, but new information is difficult for them to retain and recollect. So you also find that such people are repeating conversations. They're repeating topics. So you find, today we discuss, the person wants to discuss the same thing the next day, because that is now what they know they can remember. They lose capacity to even now know who their family members are, as the disease progresses. There are 4 major types of dementia. There is Alzheimer's dementia, which is the commonest, particularly in the Caucasian population. It accounts for about 60 to 65% of all the different types of dementia. We also have what we call vascular dementia, which we tend to find more in our environment. We have also frontotemporal lobe dementia and Lewy body dementia, or dementia with Lewy body. So those are the 4 major types. But we also have dementia that comes with infections like HIV. So people who've had who've had to live with HIV for a long time, particularly if it was not well managed, can actually develop dementia in the long term. We have reversible causes of dementia. Reversible meaning if we treat it, if we manage it, then the dementia goes away. One of them is hypothyroidism. We also have a reversible cause that is normal pressure hydrocephalus. What that really means is there's some increase in the volume of the ventricles. The ventricles in the brain are the like channels that hold water in the brain, the CSF. When that ventricle is dilated with increased volume, it also affects cognition. Vitamin B12 and folic acid or folate deficiencies in these two would also result in dementia. So these conditions must be ruled out in every person that we see with dementia as reversible causes. And if those are the existing conditions, you treat them and the dementia goes away. But where none of those exist, then we'll be dealing with the irreversible type of dementia. Now, that's a big gap. So let's even start with the gap in geriatric care. Geriatric care is multidisciplinary. You need the geriatrician, you need the nurse, pharmacist, physiotherapist, the social worker, all of who have been trained in providing care to older people. So there's a major gap in that regard. For patients with dementia, first we must realize that dementia affects not just the individual, but the family members and the community. It's a condition that really can cause a lot of burden and heartache when you see a loved one become a shadow of themselves. I'll give you an instance. I had a couple I saw last week. The man is in his 70s, the wife is early 70s as well, he's late 70s. She has dementia, she's wheelchair bound, and he's her only care provider. And it was quite heart-wrenching for me to see this older man who's still having to work because he needs to make provision for his wife, to buy her drugs and all of that. No social services available to him. He's having to bath his wife, provide food for her, basically doing everything for her because she's become that dependent. And that's what dementia does. It's not just the sufferer, but their family members are also affected. So we need a system where services are provided, and they're long-term care services, where either you're providing it in the home of the patient or in a residential facility where such an individual could be moved to, so that the burden of this care is not continuously and 100% on family members, because that's the way it is in Nigeria now. Definitely not enough. There's a lot of room to do more. So we have to not be shy to discuss this issue, and really we'll be helping those who have family members who have dementia by raising more awareness. So it's a conversation that must be ongoing. We need to put it on the front burner, and also that way those family members are empowered to seek help for their loved ones. Because right now, some of the myths around dementia, one is that it's a normal part of aging. So you lose your mind at 80. Oh well, Mama is 80. She can forget things. And so the risk is that Mama will not be taken to seek help. And age is not a disease. Yes, increasing age increases the risk for this disease condition, but everybody, regardless of your age, should have a right to access health, good quality health care, and affordable, that is provided in a socially acceptable environment and culturally acceptable. So we need to keep talking about dementia so that everyone understands it, and they bring their loved ones to seek help. Because we do have, like I explained earlier, not every dementia is irreversible. So you leave that 80-year-old who might have hypothyroidism to live with dementia the rest of her life when it could be treated. You leave the 75-year-old who might have normal pressure hydrocephalus to live with dementia. So we must make people understand that people with mental health issues must be made to seek health care, affordable and of good quality. Well, I mentioned it earlier, geriatric care is multidisciplinary, so we're supposed to have so many people who have knowledge and skills to provide care to older people. I think it was 2013 that the then Minister of Health made a pronouncement that every tertiary institution should have a geriatric center. But it's okay to make a pronouncement, but we didn't, and we still do not have the infrastructure to be able to make that happen. if, for instance, I'm the only trained geriatrician in Abuja and there are 3 tertiary institutions, that means I need to, run in between the 3 tertiary institutions for whatever geriatric centers that they establish. So that's a major constraint for operationalizing that pronouncement. So we need first to provide the infrastructure, train the healthcare workforce that will provide the care at these geriatric centers. Older people seek care at different settings. Acute care, when we hospitalize them for infection like pneumonia and things like that. Ambulatory care, when we see them in clinic and they go back home. There's also long-term care and palliative care. So across these different settings, we need the appropriately trained healthcare workforce and even other infrastructure like residential facilities. People with dementia, particularly at the late stage, are dependent for everything. And if you leave them with your family members to deal with that, it means such family members really should be provided an income, an allowance, because such an individual would not be able to fend for their own source of livelihood, because they're constantly caring for their older people.